professional midwife with Whole Woman Birth and Wellness.
And Matt Niswander, family nurse practitioner here at Niswander Family Medicine. Me and Stacie work together here in Etheridge, Tennessee, at our office. And today we want to talk to you about a pretty common problem. We're on the front porch, nice spring day, and we got a little bit
driving by,
little traffic going by.
And horses somewhere, yeah.
Yeah, you'll hear some clip clopping
Yeah.
probably. So this is something we see a lot of,
Yeah.
and something that's probably more common than is discussed. But I have people come in all the time talking about my baby's not acting right, and it oftentimes comes down to a lip or a tongue tie. So I think kind of just to start out maybe what that is. So if you're looking for a tongue or lip tie in your baby and you suspect some of the symptoms, which we'll get into later, that's going to be a little extra piece of skin that is attached to their upper lip. It can be full length gum, and it's a really thick kind of cartilage almost tissue that can be pretty easily remedied. Same thing under the tongue. You'll see them in the front, almost like sometimes their tongue pulls so tight it'll be like a heart shape to that, and then you'll see them posteriorly as well, which is a little harder to diagnose at home, but something we can do here in the office. So that's actually what a lip and tongue tie looks like. I guess probably next what we need to talk about. I know you see a lot of people.
I mean, we see lots and lots of babies that have tongue and lip ties, and they basically, like when we have a baby born, that's one of the things that we check with the newborn exam. So we'll catch it then before they even nurse for the first time most of the time. But we have a lot of women that come in that are complaining of, cracked and sore nipples, or a decrease in milk supply, or the baby's really gassy or colicky, and those are just some of the really common things it can cause, and they just think, oh, I just have a really fussy baby, or I just don't produce enough milk. But that's not it. So the problem that a tongue and or lip tie can cause all of those things. So, and it's really easy, like Matt said, it's really easy to fix. It's really easy to diagnose, and it's really easy to take care of. Even formula-fed babies that take a bottle, they can still have problems from, being tied. And one of the common things with them is they're gassy, they're colicky, or milk will come outside of their mouth, run on each side of the mouth when they're trying to take the bottle. So, but we see a lot of that. It's pretty common. I think like 20% of babies that are born have either or both. Yeah.
They got I know a lot of times I see moms come in and they'll say, well, my baby nurses as frequently as he should, but he's still crying and whining, and he seems like he's not getting fed or full. And that's a pretty common complaint, and oftentimes you'll see a lot of engorgement. That where my baby's nursing normal, but he acting like he's not satisfied.
Right, and they don't get a good milk exchange, and that's what happens, especially when they have like a posterior tie that you can't really see. So when a baby nurses, the tongue does this wave motion, and so if it's tied posteriorly, then it can't do that, and so it's not getting good milk exchange, which will cause lots of problems for mom and baby. And one of those things is engorgement and mastitis, and drop in supply and stuff like that.
I see a lot of people come in, they'll say, my baby spits up more than other babies do. This baby spit up a lot.
That's a big common complaint too.
Or like digestive issues where they're having like excessive diarrhea or bowel constipation even sometimes. So I know that's a pretty common thing that we see a lot of times, and we think, well, they've been told their baby has heartburn or indigestion or reflux.
Right, and even treated with medicine sometimes.
Actually, all the time, prescription-wise. And then they come in here and we're like, well, maybe he has reflux because he has a lip tie or she has a tongue tie or whatever it might be. So those are some of the symptoms a little bit that we see. And a lot of people come in here and they're like scared to talk about it because they know their baby's going to have to get, it's going to have to be fixed.
They're afraid of what's going to happen if they say, yes, there is a tie.
Even though they want it fixed.
Right. It's actually not that traumatic to have it done.
It's pretty simple. We do those here in the office, and like I said, Stacie identifies a lot of those sometimes at birth even, and we'll fix those. We try to fix them as early as possible. But the way we kind of do it is we bring the whole family in if they want to come in. If mom and dad wants to videotape it, they want to be involved.
Whatever's most comfortable.
And the babies, it's we're really knowledgeable about pain control and worried about that. Want the baby to be comfortable, obviously. So we usually just kind of papoose them a little baby burrito.
Wrap them up, just mostly so they'll be still, for their protection. Just so they'll be still.
And then we a lot of times a lot of parents are okay with it. If they're fine with it, we use a lot of Arnica.
So Arnica is like a homeopathic that's for like trauma to the tissue, and that really helps. And they can even take it afterwards, and it's not harmful at all. But I mean, it's actually not a very painful procedure, and the pain does not persist afterwards either. Um, so, and because I think one reason for that though is because we use the scissors.
Yeah, there's a study you shared on that recently.
Oh yeah, so yeah, Dr. Jack Neiman, he is like this world-renowned pediatrician, and he's also an IBCLC, and he specializes in ties. And he actually did a study that with scissors versus laser, and because everybody kind of thinks that laser is the way to go, but actually he found that it was not, and that lasers can take longer to heal and can cause more scarring and stuff like that. He also does not recommend all of those painful stretches and rubbing it and all this stuff, because what other wound do we rub continuously?
Yeah.
So yeah, doesn't make sense.
Yeah.
But so he didn't recommend that either. And he actually, like I said, he had a study on that. So and I mean, the scissors is quick and easy, and yeah.
And the babies do really good.
Oh,
I
yeah.
have mamas that come in and dads that are worried about it, with their kids, and they had kids that had problems growing up, and they realized they had a tongue and lip tie the whole time, so they want to make sure they fix this one, but they're scared of the procedure, and afterwards what's shocking to me, to the mom mostly, is how quickly they breastfed their babies within 5 minutes after this procedure.
Highly encourage that. We encourage, and really, after you have this done, you really do need to see an IBCLC. You really do need to have a breastfeeding consult to help perfect that latch.
Yeah, because it changes after that clip.
Yes.
We see a lot of times the babies almost get confused.
They do.
About what to do, and so it's kind of train the moms to kind of coax the babies in doing it properly.
Oh yeah, once they can move that tongue, it's before that they're kind of chomping, they're kind of biting, but once they can move the tongue and it's the sucking motion. I know, like River, my 11-year-old, he was very tongue-tied. We knew he was tongue-tied, but I had already breastfed 4 kids, and I had plenty of milk. He was fat. It was not affecting him. So I kept putting it off. Yeah, we'll clip it sometime. We'll clip it. So he was like 10, 11 months old, and he was crawling around on the floor. And I had tried to give him like mashed up banana, and he couldn't really eat it. And I just thought, he's just not ready for it. But he picked up a little chip, and he put it in his mouth. And one of my other daughters, who was a teenager, come running through the house with him, screaming, and he was blue, because he could not swallow the chip and he got choked on it. So after that, I was like, okay, we're going to have this fixed. So even him being that big, as soon as it was done, like an oral surgeon actually did his, because back then, I didn't really know anybody that really did it. So he couldn't believe he breastfed, for one. And he was, as soon as he was finished with it, I said, can I nurse him? And he was like, yeah, sure, see what he does. He felt like a Hoover vacuum. It was like the whole sore nipples all over again. It was because he felt like a different baby. So it can make that much of a difference that quick. So, and instead of like the stretches and stuff, we just encourage suck training and things like that to kind of teach.
And that's something like Lactation Consultant, if you work with the Breastfeeding Consultant, they'll give it to you. Certain things that they can do that nobody else will be able to tell you.
Yeah.
So we said, how old was River when you did it?
He was 11 months.
I see. And so that's the thing. I mean, we try to fix them quick, but I have done it all the way up to a year old without any issues. It's a little more, the baby's a little stronger.
Right, yes.
It's a little more complicated.
A little harder when they get older. And plus, they've already started to develop like the speech and those muscles.
Teeth.
Yes, and teeth. And they're already developing, everything about their mouth is already developing by that time. So it's really better to do it earlier.
Yeah, because that long-term effect of that tooth decay, that gum, a baby should be able to flip their lip over their nose, basically. And if not, that lip tie will pull their gums up, expose the roots of their teeth, and cause a lot of rot. And then, of course, speech problems later, and digestive issues, and things that sometimes, if you learn it that way and it's long-term, it's hard to unlearn. So,
it really is. So it's not a big deal to fix. It's not a big deal to diagnose if you have someone that knows how to do that.
Yeah.
And it's not a big deal to fix if you have someone that knows how to do that. Right. And insurance will pay for it.
Yeah.
So that's the other thing. It's really not that expensive, and insurance will pay for it. So it's really something that you don't have to just live with.
Yeah. And if you wonder, like, I wonder if my kid has he has these symptoms, I wonder if that's what it is. We can come in and check them out, and that's something we can figure out with you. If that's an issue, we can fix it before it gets too bad. So
easily done.
Yeah, that's right. So cool.
Yep.
Well, that's cool. So that's a little thing on lip and tongue ties. And if you guys have any questions, please comment below and let us know. And And I think we're kind of interested in seeing what people are
Oh yeah.
feeling out
Yeah.
more of these little
Yeah.
porch sessions.
Yeah. This is our little, our little. What are we gonna call it? Like
I don't-
porch talk. I don't know.
Yeah, help us come up with a name or something.
Yeah, but yeah, we want to know what you want to hear about. So, I'm also a certified herbalist. Matt is full of knowledge. He's like an encyclopedia over here. So, I mean, whatever you guys want to hear about, like what you would like to hear us talk about, we'd be glad to do that. And just let us know.
Cool. Thanks for joining us. Talk to you soon. Watch Keep Up for more videos.
All right.